Hello guys, good afternoon. This is Professor Henderson and I'm coming to you again with a simple video on pharmacology. So these videos are meant to, not meant to replace your readings, but they are meant to supplement your learning. So please consider subscribing to my YouTube channel, like, share, and subscribe. Thank you. So let's look at the student learning objective for this lecture. So upon completion of this lecture, student will be able to demonstrate the following competency. 1. Convert weight of a child from pounds to kilograms. Convert neonatal weight from grams to kilograms. Demonstrate competence in pediatric calculation. Determine minimum and maximum dose. Calculate safe therapeutic dosage. Compute IV medications for pediatric patients. Demonstrate how to calculate body surface area for weight-based medications. Ability to integrate nursing consideration when administering medications and clinical judgment to enhance patient safety. So these are the SLO for today's lesson plan. So the student learning objective is very important because it actually guides the it provides a framework actually for the lesson plan. So these are the objectives that you should grasp upon the completion of this lesson plan. So let's look at the first problem. Converting pounds to kilogram. This is a very simple calculation, guys. So I'm going to walk you through. So we have question 1. An infant weight is 24 pounds. Convert this to kilogram. So as we know, 1 kilogram is equal to 2.2 pounds. So using dimensional analysis, we are going to be setting up the equation using dimensional analysis. So we're looking for X kilograms. So 1 kilogram is equal to 2.2 pounds. And we were giving 24 pounds. So pounds and pounds canceling out. So we have now 24 pounds divided 2.2 divided into 24 is equal to 10.9 kilograms. So that's our answer for question number 1. Now we have question number 2. A neonate weight is 2,300 grams. Convert to kilograms. So in order to solve this problem using dimensional analysis again, we're setting up our equation isolating the variable that we are looking for. We are looking for X kilogram. So we have to know that 1 kilogram is equal to 1,000 grams. And we were giving 2,300 grams. So grams and grams canceling out. And we have 1,000 into 2,300 gives us the answer of 2.3 kilograms. So these problems are very simple. They're not complicated at all. They're very simple. It's just setting up the equation and looking for what you're looking for. That's very important. So I have another problem here, and this time determining safe therapeutic dose. So the physician has ordered 210 milligram of acetaminophen Q4 to 6 hours for pain and fever for a child who weighs 39 pounds. The recommended dose range for Tylenol is 10 to 15 milligrams per kilograms per dose, Q 4 to 6 hours. Acetaminophen is available in 160 milligrams per 5 ml. Is it safe to administer the drug? How many ml will be needed? So first, what are we looking for? First, we need to determine the safe dose. So we are looking for acetaminophen is available in 160 milligrams. Is it safe to administer the drug? How many mLs will be needed? So we're looking for first the safe dose. So we are setting up the equation. Look for X milligrams per kilogram per dose. So the physician has ordered 210 milligrams. So we have that data there, right? Per dose. Then we know 1 kilogram is equal to 2.2 pounds. We were giving the weight of the child, which is 39 pounds. And we know 39 pounds goes here, right? So now we are ready to solve this equation. So we have pounds canceling out with pounds, right? And now we have 210 milligrams times 2.2, which gives us 462 milligrams. Now in the bottom, we're left with kilograms per dose. So 39 goes into 462, 11.8 milligrams per kilograms per dose. So first we have the safe dose is established in question in the first part of the problem. So yes, it is safe to administer the medication since the safe therapeutic range is within the parameters of 10 to 15 milligrams per kilogram per dose, and our calculations falls within that therapeutic range. So now the second part to the problem is that how many milliliters should the nurse draw up in the syringe? So using dimensional analysis, we're looking now for XML. So we were giving 5 mLs. So we have 5 mLs up here. And we were also given the available dose of acetaminophen is 160 milligrams. So we have 160 milligram at the bottom, and we were giving the doctor's order, which is 210 milligrams. So I have 210 milligrams here. Now using dimensional analysis, we're going to cancel milligrams and milligrams is going to cancel. So 210 times 5 is 1050 milliliters. And then we have in our denominator 160 divided by this. So the answer would be 6.56 mLs. That's what the nurse is going to actually pull up in the syringe to be administered. So we have another question here, pediatric intravenous medication calculation. So an infant, an 18-month-old infant has an order for an NSAID 450 milligram Q4 hours IV piggyback over 15 minutes ordered. The child weight is 19 kilograms. Thus, the maximum recommended infusion concentration is 50 milligrams per ml. The vial of medication has a concentration of NSAID 250 milligrams per ml. How many milliliters medication will provide 450 milligrams? How many mLs of IV solution needed to be added to the medication to equal the recommended concentration. How many ml will you program the infusion pump? So it's actually three components to this problem. So first, we are looking how much will the nurse withdraw in the syringe from the vial to administer 450. So now using dimensional analysis again, we are setting up our equation. We are looking for XML. So we were giving NSAID of 250 milligrams. We have that set up in the denominator, and the order was 150 milligrams. So milligrams and milligrams canceling out. So now we have 450, 250 divided into 450 is equal to 1.8 mLs. So that's what the nurse is going to be pulling up into the syringe to administer 1.8 mLs. So the second component of the problem is asking how many milliliters of IV solution needed to be added to the medication to equal the recommended concentration. So we have here the concentration. We have here, using dimensional analysis again, we are setting up our equation. So now we have here XML. So we have 1 ml is equal to the concentration, which was giving 50 milligrams, and our NSAID order was 450. So milligrams and milligram canceling out. So we have 450 divided by 50, so 9 mLs. So how many mLs of medication will be provided? How many mLs of IV solution need to be added to the medication to equal the recommended concentration, which is 9 mLs. So the third part of the problem, how many ml will the nurse program the pump? So we have another, the third component of the problem is that we're looking for XMLs per hour, which is our flow rate. So we have 9 mLs, and we were giving a time of 15 minutes. So 15 minutes, we got to convert that. We have to know 1 hour, we're looking for hours, so we have to convert minutes to hour. So 1 hour is equal to 60 minutes. So minutes and minutes canceling out, and we have 60 times 9 divided by 15, and that gives us 36 milliliters per hour, and that's what the nurse is going to program the IV infusion pump, the rate of 36 mLs per hour. So it's important that you know how to set up these equations. The problems are not that difficult to solve. It's just what I find is that nursing students have a lot of difficulties in actually setting up the equation. So it's always important. The rule of thumb is that you always isolate the variables you're using. So you could use dimensional analysis, you could use the formula methods, but you should come up with the correct answer using any one of these methods. So it's important that you isolate the variables that you're looking for so you can able to solve the problem. But I think using dimensional analysis, I find that to be a more effective way in solving a lot of pharmacology problems, because sometimes it's very hard when you're using ratio or proportion or the formula method. It sometimes there's many steps, but if you kind of systematically use dimensional analysis, you can actually isolate the variable that you're looking for, and it's the steps are kind of reduced using